It was the turn of the 20th century, a time when most West Shore communities along Lake Erie were growing from sparsely populated villages to modern, bustling cities. Lakewood, Ohio, too, was a rural outpost in transition. The landscape dotted with farms, vineyards, and orchards, the population stretching to reach the 2,500 mark. Lakewood was a diverse place. On its eastern edge, a vibrant community of Eastern European immigrants who worked factory jobs in the growing carbon district. Along the lake, north from Lake Avenue and Clifton Park, sat the sprawling estates of some of Cleveland's wealthiest families. The nearest hospital at the time was over an hour's trip away by horse-drawn wagon, an hour which could mean life or death for Lakewood's early residents. The year was 1907. An ambitious 33-year-old had a dream. After receiving his medical training at the University of Cincinnati, pioneering physician Dr. C. Lee Graber was determined to build a hospital in Lakewood, Ohio. Dr. Graber and his wife Belle mortgaged their home to finance construction of what was to be the first hospital established in any Cleveland suburb. The venture was so risky that the Grabers built the house so that it could be easily converted into a two-family home if the hospital was unsuccessful. Dr. Graber's close associates in this endeavor were Wallace Benner and Dr. Alfred W. Anderson. Both, along with Graber, formed the hospital's first medical staff. Lakewood Hospital was officially up and running, but money was tight. According to Belle Graber, Lakewood, Ohio was too young and much too poor to finance the establishment of a hospital. These concerns led to the establishment of the Lakewood Hospital Charitable Association in 1908. Formed to raise funds to provide care for the indigent, the association later became the Women's Board, creating a tradition of community support for the provision of care to all. Within a few years, the city's healthcare needs had outgrown the original 15-bed facility. The onset of World War I, however, delayed construction of a new building. Additional beds were squeezed into existing rooms and wards, and eventually the hospital's outdoor porches were enclosed to provide more space. In 1917, a new 4-story brick building was finally erected in front of the original frame house. As a new decade approached, wartime effects were felt stateside. In 1918, the hospital assumed operations of the Rhodes Home Hospital in present-day Lakewood Park for the care of wounded soldiers returning from the war. Later that same year, the Spanish flu epidemic swept the nation. Much of Lakewood's population was affected, putting a strain on every aspect of community life. Even with the latest architecture and technology of the time, Lakewood Hospital was again stretched beyond capacity. The World War I years were tough, but with the compassionate support of the community, Lakewood Hospital persevered. In 1931, the citizens of Lakewood voted to transfer ownership of the hospital to the city and finance a needed addition. The Great Depression, however, created financial hardships that delayed the expansion. During the World War II years, doctors and nurses not called to war worked day and night. Local residents stepped up to help out with the creation of the Lakewood Hospital Volunteers Association in 1941. The post-World War II years saw new demands on hospitals in the United States. Lakewood Hospital was no exception. In 1945 and 1946, Lakewood voters went to the polls twice to approve hospital improvements and expansion. Construction was completed in 1951. With this additional space, the hospital was able to increase its capacity to over 350 beds and bassinets. In the 1950s, Lakewood Hospital established the first psychiatric service and the first physical, medical, and occupational therapy departments in western Cuyahoga County. To ensure the hospital would have the resources to continue providing leading-edge care, and to ensure all who needed care would have access to it, regardless of means, the Lakewood Hospital Foundation was established in 1956. In 1975, Lakewood Hospital became the first in Northeast Ohio, and one of only a few in the nation, to offer hospital-based ambulance service. Lakewood Hospital President Jack Guston started his career in healthcare as part of this original group of EMTs. Today, the hospital remains at the forefront of the region's emergency care system as a Level 2 trauma center. The 1980s marked a time of tremendous progress at Lakewood Hospital. In 1985, Lakewood Hospital was the only remaining city-owned hospital in Ohio. That year, Lakewood residents voted to allow the city to lease the hospital to a private, nonprofit entity. The change in governance ensured that Lakewood Hospital would continue to deliver quality health care to area residents without the use of tax dollars, then or in the future. It also paved the way for Lakewood Hospital to begin working in partnership with other healthcare providers. In 1996, Lakewood Hospital and the Cleveland Clinic announced their intent to partner. Fairview and Lutheran hospitals also joined with Cleveland Clinic, and together with Lakewood Hospital formed the Cleveland Clinic Health System's Western Region. Today, Lakewood Hospital programs are recognized as centers of excellence in 12 clinical areas.